Also making national news tonight, the Public Hospitals Authority continues to bleed millions of dollars each year. Minister of Health, Dr. the Honorable Dwayne Sands, said it is no different this year, with losses said to be in the double digits. He gave our Cleopatra Murphy an insight on what steps officials intend to take to remedy the situation.
Minister of Health Dr. the Honorable Dwayne Sands says the Public Hospitals Authority is anticipated to experience a deficit between $26 million to $50 million in 2018, depending on revenue earned this year. He says it has serious implications on operations and delivery of service at public healthcare facilities like the Princess Margaret Hospital.
That clearly means that we are unable to pay bills for medication, to pay staff, to keep the lights on, to improve the facility, to maintain equipment, and on and on and on. And this has serious implications for the care of patients.
Minister Sands confirmed that in the first quarter of 2017, the P.H.A. had a $9 million deficit, and that grew. He says the only way to make up the shortfall is to eliminate waste, cut expenses, or increase revenue.
We either identify the funds from the consolidated fund, meaning we go to the Ministry of Finance and seek to get additional funding, or we insist that the legally mandated fees that ought to be paid by patients, which are generally not paid by patients, are paid.
The Minister of Health previously stated that 60,000 patients visit the emergency room at the Princess Margaret Hospital annually, and the facility collects less than $200,000 annually. He says the aim is to increase revenue collection.
We are seeking to improve revenue performance by going after insurance revenues that we're not getting, through NIB, through the insurance plans that persons have, and to ensure that the public understands that this is about improving the services.
Sands says more than 87% of people who utilize public hospitals do not pay, and he urges the public to consider the overall expense.
When you next come to the Princess Margaret Hospital and you're asked to pay $10 for an emergency room visit, pay the $10. When you come to the hospital in an ambulance and you're asked to pay for the ambulance ride, pay the ambulance ride.
Cleopatra Murphy, ZNS Network News.